everyone. Hi, welcome. I'm Vicky. I'm the PA and injector at Skin Perfect Brothers. Can you all hear me? We're giving 5 minutes to wait for people coming in. Meanwhile, if you can say, your name and where you're from, I can say hi to you guys. And also, if you like to share what you've been doing during lockdown, that would be great. Okay, hi Devin, hi Tina, hi Diana. So many people. Hi Carly. Good morning. Hi Samantha. How are you doing? Hello Michelle from Chino Hills. Good morning. I know, Samantha, I can't wait either. All right, so while we're waiting, I can make a couple announcements. So we're thinking to answer Lorraine's question, we're thinking to open on May 16th. We're gonna start book appointments slowly during the first couple 2 weeks. Good morning, Marie. Right. But right now, okay, so right now we're currently open for online consultations to help you with any skin troubles that you have. You can always text us and book appointments online. And or you can find our information and our phone number down below the video. And second, if you haven't done so already, you can please subscribe to our text, Instagram and Facebook for our upcoming promotion, which is Mother's Day. That's in just 2 weeks. If you follow us, we're also have a lot of flash sales from time to time. Those are the best deals that you don't want to miss. So right now, while waiting, you can go to our Instagram at Skin Perfect Brothers and our Facebook, just join, or you can text bros to 31996 to sign up for our VIP deals. Those are very good. Yes, Dana, I understand. Everyone needs their Botox. Yeah, so to answer, Helen, to answer your question again, we'll be open again in May 16th. That'll be the first day. We're gonna have a slow opening. And right now, but we're open for online consultation. So the number you can see the information. If you scroll down under the video, you will see the first line is text BROS, BROS to 31996 to sign for our VIP deals. And we just send you a link to book online appointment. So what you can do right now, you know, there's still like about a week before opening. So what you can do is book a virtual consultation first. So when you come in, you can just get the treatment right away. You don't need another consultation. And we just posted a text number 909-839-0714. You can always text us or you can message us on Yelp. Our usual response time is within like 1 or 2 hours. Very fast response. Okay, oh, and one more announcement, last but not least. So we have Instagram Live every Sunday at 2 p.m. And we talk about, you know, like how to take care of your skin, what ingredients you should be looking for in skincare products, and just some tips on how to stay healthy during this pandemic. So you can, you know, on Sunday, 2 p.m., every Sunday, 2 p.m. All right. And we'll be starting in 2 minutes. You're gonna see Joseph very soon. I'm sure you all miss him and Rosa. Hi, Sandra. Hi, Sandra from Walnut. You're a local.
Hi, everyone. Welcome. This is Joseph here at Aesthetics and here in the location Skin Perfect Brothers. Most of you guys already been here. Hope you're staying safe, and on behalf of all our team members, we're sending positive vibes to you. So today we're going to talk about the jawline.
Joseph, do you want to start right now?
Yeah.
Okay, so then let me do a brief introduction and just to tell the audience how this talk is going to be. So for those of you who just joined, hi everyone, happy early Mother's Day. Thank you for joining us. I'm Vicky. I'm the PA and the injector at Skin Perfect Brothers. So today we're going to have our very own Joseph talk about jawline contouring and do a live demo on our lovely Rosa. If you have any questions during the talk, please post them on the comment section with your name. We will have a Q&A session at the end of the demo. So this talk will last about 30 minutes. Stay tuned. At the end of the talk, we're going to post a link on the comment section. And that's where you can get the buy 100, get $100 free gift card. We'll talk more details at the end. And now let's have Joseph take over. Go ahead, Joseph.
Hi, everyone. This is Joseph with Aesthetics at Skin Perfect Brother. Hope you guys are doing well, staying safe, and on behalf of the entire team, we're sending positive vibes to you. All right, today we're going to talk about jawline, and we're going to mention 3 components. First is what really defines the border of the jawline. That's number one. Two, what causes jawline aging? Number three, how to treat it. What are some of the treatment options? So let's jump right in. The first component, which is what defines the jawline. All right, thank you, Rosa, our lovely manager here. So jawline extends from the chin, right here, all the way up to the angle of the jaw. That's our jawline region. Number two, so what causes aging in this area is one, as the skin sags down, it kind of collects excessive skin here. That's the first. Second, in this jaw region, two things can happen based on genetics and also aging. The first thing is due to a lot of chewing or bruxism or just biting issues, this here could bulge out and causing disharmony in the jawline. And that makes it more masculinized. We could feminize that area. So the second thing about this jawline angle is when we're younger, it's an L shape like this, a nice definition. But as we get older, the shape becomes straight and I. Okay, we could use fillers for that. Now moving on to the third causes of jawline aging is this area of the chin could be shortened due to loss of bone in this region, or some people just genetically have a shorter chin. And we could, so once we treat this area, the jawline kind of gets longer and it brings harmony to the entire face. All right, the fourth one would be right here. In the mouth corner. And as we age, there's a jowl fat there. It kind of shifts down and the jawline, the line here becomes irregular because this part kind of protrudes out of the jawline. Y'all see some of that in the photo? Thank you, Rosa, you're looking so great. Number five, we have the fat in the chin area that could kind of protrude out, that bulge, or fat here, it could bulge out. Okay, so all that factors contribute to an aging jawline. And yeah, now I'm gonna take you guys to the slides now. Let's look at the slides. All right, so number one, okay. All right, you guys seen it? Okay. All right, so there are about 6 factors that contribute. Number one, you guys can see is the skin sags down. And number two, okay, the jaw angles actually widens from an L to I shape, and it bulges out. 3, the chin can shorten, and it could collect wrinkles there. 4, the jaw fat droops down. 5, the neck area could bulge out because of fat or loose skin. Number 6, there's this muscle that comes from the clavicle all up to the jawline to pull down the jawline, and we use some Xeomin, form of Botox. And overall, that aging process caused the jawline to disappear, become invisible. Okay, so let's go to the next slide. All right, so this beautiful client came in and she pointed to her mouth corner region. So is it fat or is it loose skin? Our assessment is that it's loose skin. So if you look at the first photo on the top and the second photo at the bottom, you could see huge improvement. So what we did was using radius to lift that region, and then she has a tighter jawline. If you have that issue, please, ask questions, text us. Let's have fun. It's mingling, chatting time. All right, next photo. This youthful page. Let's look at this. It just get a taste of what the actual procedure looks like. I want to impress upon you 2 things. It's not painful because we have a comfort protocol that involves using cannula. And second thing is that she already has very youthful jawline. And why is she doing this? Because prevention. It grows collagen. The product we're using is called the Radiance. All right, let's go on to the next one. All right, that's our manager, Rosa, you just saw. So, genetically, we have a shortened chin. And in this case, or aging could shorten the chin because of bone loss. In this case, we extended her chin using Radius. So that kind of give her a more slender profile. So the arrow shows the bottom and the top shows after. Shorten and now lengthen chin. And better jawline. Next photo. The patient came in and her main concern was, she said, Joseph, I just can't get rid of these wrinkles around my mouth. And I can't really see the jawline like when I was younger. So we actually did 2 Radius for the mid face, but what really contributed to the improvement of this wrinkles, the improvement of it is Xeomin. We injected Xeomin in and around neck areas and then around the jawline area. And I was personally surprised how well it worked in her as well. So she has a smoother jawline. Again, if you have a mirror, you could take a mirror and kind of look, and we could have fun, assess together, and ask questions. Text us. All right, next photo. All right, this beautiful young patient came in and she kind of pointed to her jaw. Now, she has a strong jaw, a square, large muscle there. A lot of times it could be caused by bruxism, biting, and clenching in the evening, but that was not her case. This is just a natural genetic thing. So look at the after photo. Notice that we feminized her jaw. So what is a standard of beauty in female in terms of facial proportion? The lower face should be always less and more tapered, slender than the cheek area. So they did a study of the beautiful people. The number 1 sought after facial shape is oval. The second is heart shape, and so forth. So we ovalized her facial shape and softened her jawline. Okay, let's go on to the next one. All right, this patient came in, her concern was number 1, the mouth corner area. So I'm gonna show you the circle there. Now the question is this loose skin or fat? We determined it was fat. Now fat carries more weight, so we chose PDO threads, which give you a lot of lifting, and we lifted her mouth corner nicely. So overall, it kind of blends in. Her jaw now blends into her facial feature. Okay, let's go on to the next one. All right, so now there's a lot of bulge underneath the chin and the jaw area. And if you look at the after photo, that bulge kind of went up. Now, is this fat or just loose skin? That's why it's good to come in for assessment to determine the causes of the bulge. So it's loose skin. So we tighten her skin using our therapy, an ultrasonic device that really tightens the deep layer tissue. So it's tightening using ultrasound. Let's go to the next slide. All right, now the similar bulge except it's larger. In this case, it's not mostly loose skin, it's mostly fat underneath the chin. So the second arrow shows that the fat is dramatically reduced. And the treatment is called Cabela. It's a type of bio soap. It's an injection. All right, so let's go on to the next one. All right. After 17 years of aesthetic practice, what's the number 1 thing that most people sought for, and what's the number 1 thing that also most difficult to treat is the jaw fat, okay? Instead of going for the lifting with PDO, in our case, we actually went for injection using Cabela. You see that circle of before and after Cabela. Again, it's a small injection to dissolve that fat in that area. A nice, beautiful contour of the jaw. Okay, let's go on to the next one. All right, so this beautiful patient, it's aging gracefully. Her treatment protocol Step one is would be filler. So we kind of volumize her mid face. We use 4 to 5 vials over a period of a few months. Now the crucial point is this: we would not do this for younger patients. Okay, everyone has different volume loss. In her was a volume loss issue. As we volumized her jawline lifted, and also then we did Zeoman at the bottom of the neck, and to stop the pulling force of the muscle on the jawline. And lastly, we did PDO threadlets, and I think she looks pretty good. All right, so if you have any question, go ahead and type in those. Go ahead and type it in, and I'm gonna give it back to Vicky, and as I prepare for an injection.
Hi everyone, I'm back. Okay, so Joseph is preparing for injection, do a live demo on Rosa. Meanwhile, let me just answer a couple questions that you have. Okay, so Tina L says, I'm freaking out from not having facials during this time. Okay, we will be open in a week, so you can start book appointments. You can call us, you can text us. All right. Helen says, is it possible to just book an appointment without the consultation? I've been a regular customer for several years now. I just need my Botox and fillers. Yes. You can book an appointment, and then when you come in, we will assess your condition and give you a treatment plan on that day, and we can give you the treatments. So that's absolutely okay. Just call us or text us to make appointment. Kathleen says, are you open and taking appointments? Yes, we are taking appointments and we'll be open in a week. All right, so Devin asked, what is a cannula? So let me answer this for you. So cannula is it's a tube that we use instead of a needle. So a needle is a sharp end versus a cannula is a blunt end. So it's safer than a needle. It doesn't puncture blood vessels and accidentally deposit products in the arteries. So there's a safer and less risk of that. So I think Joseph is ready to do the live demo. Let me have him take over.
Hi everyone, I'm back. So we usually design the face instead before we do the injection. So what I have in my hand is a HA filler. I love radius, but on the demo today I'm going to be using an HA. And to contour the jawline, I'm going to use the filler to inject 3 points. I'm going to inject here, here, and here. Okay, and you'll see that that'll create a more smoother profile. And I know many of you, like Helen, and I remember some of the names I saw. I wish I could name all of them. You guys, we all had some of these injected. So I'm gonna pull up the skin and go ahead and enter slowly. And there's lidocaine in here, and just a very small injections there. And number 2, so the benefit going to experienced artists, injection artists, is that we know the artery, we know what layer to put it in. So there are these arteries and nerves running around this area at a deep level. So we're going to go superficial. And it doesn't mean that if you avoid the artery that you won't have a little bit of blood. It's okay if it bleeds, and you could just kind of cover it. So the 3rd injection involves, now, Rosa's been with us for a long time. You guys saw her before a photo, and we've been extending this trend for the past, many years. And so I'm just gonna put a drop just to demo, like right here, in. And she's being paid to say it doesn't hurt. Just kidding. I'm pretty sure we're pretty good with this. many of you could testify it doesn't hurt that bad. So that was using fillers. Now I'm gonna go ahead and demonstrate improving the jawline using Xeomin, which is more pure than Botox. So again, I'm gonna design the face real quick. We have fillers placed here already. So I'm gonna choose a spot on the side here. And I'm gonna choose a spot here, here, and here. So what this will do in this angle, it could feminize the large masculine jaw using Xeomin. Again, this is a very safe area, and you could, it's a deep injection. And then could you touch your head? So we're gonna put a few drops of, here's the jawline. We're gonna go ahead and treat the jawline, and this would be a superficial injection. We're targeting the platysmal muscle. In case I just blocked the view, let's do this one more time in this area. Okay. So treating this area will stop the downward pulling of the muscle. So we're really treating the platysmal muscle from pulling the face downward so that the muscle here could elevate the jawline. Okay, now I'm gonna turn back to Vicky as I finish the injection on the other side. We'll take questions. Come on, let's have fun, guys. Ask away. I can't wait to see you guys.
Hi. Okay, so Joseph, do you want to zoom in and see and let's see the difference? Rosa looks great right now.
Okay, let's do a frontal view. Okay, so as you can see, the treated area is more lifted. And we're just using 1/5 of what I usually put in just for a demonstration. I imagine if we put in everything, it would be like, lifting a lot. And if you guys remember the photo that you just saw of Rosa before the V-line contouring, we definitely improved this area. Can we just out of the pro? Can we go back to the slide just real quick if it's possible? I want the staff to the audience to see. Go up to the third slide. Go all the way up to the top. Okay, so we're getting that slide ready for to show you guys. Go down. Oh, right there. Okay, we're just gonna keep going. Okay, it's gonna take another 5 seconds to go there. Keep going down. Keep going down. We're almost there. Thank you for your patience. Right there. So if you can see the bottom in her chin region and her jawline, what we've been doing for her is extending the chin and slimming down the jawline. As you can see right now in real life, let's come back here to the real life picture. You can see that the chin's been extended and the jawline's been feminized. And she already looked pretty good. We just did a little bit of contouring over the years and she looks great. Okay. Great.
All right. Okay, Rosa looks amazing. Even better than before. I'm very jealous. Okay, so all right. So while Joseph is finishing on the other side, let me just answer a couple more questions. So Sherry said, okay, so there's actually a lot of people who's interested in PDO threads and really want us to do a live on PDO. So that's, yes, if you are interested, please let us know at the end of the video. We're going to post a survey link. We're also going to email you the link. So the survey is very important to us, to serve you better, to have future videos more suitable to your interests. So if you're interested in any particular treatment, please fill out the survey and then let us know what you're interested in so we can we can do our future events around your interests. Okay.
If I could just add a comment about PDO, one of our staff member will post videos about PDO. Can we post on Instagram? And there are a lot of real life treatment for PDO of the jawline and of the face. But yes, I will demonstrate live on next session PDO treatments.
Okay. All right. So let's see. So there's a couple patients said they text there. So Lorraine said my appointment was the day after you closed down, and some of my procedure has already begun and paid. Yes, you can. Can I just make an appointment to proceed? Yes, of course. You can just make appointment after we open. That's absolutely fine. Just give us a call or text us. And she also says, can I purchase the gift certificate for my own use and still get the promotion? Yes, definitely. The gift certificate, the gift card, you can use on top of Mother's Day promotion. And you can also purchase for your family member, your friends. The only thing is that you can only get one gift certificate for one person. So if you purchase it for your mother, you can use that one gift certificate for your mother, but you cannot use 2 certificates for yourself. Right? Okay, so how long does the PDO thread last? So we're gonna do, like Joseph said, we're gonna do a PDO live in the future, but just quickly answer your question. PDO threads usually depends on what kind of threads you get. Usually it lasts about 6 months to a year. And also depends on your metabolism. We're gonna talk more details in the future. So I think Joseph is done finishing up. So let's take a look.
Okay, so what as you can see, her jawline is a little bit more lifted than before. And if we're to, okay, how old are you, if you don't mind sharing with the audience?
36.
No, she's 36, yeah, so she's doing great. I would recommend an oral therapy treatment where we could tighten some of these area and here. Okay. Since there's so much interest about PDO, who is a good candidate for PDO? Just really quick, if you have a lot of tissue, you're a good candidate. If you have a heavy jawline right here, which filler won't be able to achieve that full lifting, PDO will help with that. With the V-line method, we combine different modalities, PDO, fillers, and Xeomin. So there are 2 kinds of threads in PDO. It could be a large thread that comes this way to pull, or it could be small threads, which we could place here along the jawline area. So if you have any more question about that, join us next time for a PDO live webinar. Okay, Vicky's gonna, if I could answer any question for you, Vicky, you could go ahead and ask.
Okay, so let's enter the Q&A session. So I did answer some of your questions, but I'm sure a lot of you want to hear answers from Joseph. All right, so Cindy says, Joseph, it's Cindy. I can't wait to see you. I need fillers. When can I book? Joseph, I think you're muted.
Hi, Cindy. So we're open on the 15th. So go ahead and book. Can't wait to see you guys. Start booking this week for after the 15th.
Okay, and Kathleen asks, there's a Mother's Day promotion. Where is the details?
Okay, so you're gonna get a link today. Click that, you'll get the gift card for today, and then sign up with our specials. You'll get it in your text and your email once the Mother's Day promotion starts in about a week. So sign up Can you post the link, Brian, for this? If you click and sign up, enter your email and your text and that link that we're going to give you right now. So we never done this before. Take advantage of the special. We call it the double dipping. You could get 2 savings, one from today and one from the Mother's Day. So lots of savings, guys.
Okay, let me just add to that, Kathleen, and for anyone who's interested. So to get promotion, the fastest way to know our Mother's Day or any promotion is to subscribe to our text, follow our Instagram and Facebook, and you will get you will be the first person who get the promotion. So we have promotions, very often. So make sure you watch out for those. And next question. Okay, so what's the difference between Xeomin and Botox? How do they work differently? Joseph, can you open your mic?
Okay, so for the first 15 years, we've been using Botox, and we noticed, and if you could kind of look around the web, people are noticing resistance or intolerance. So for this 2 year, we're using Xeomin. So different is they're all exactly the same molecule, botulinum toxin A. Now Botox, what they call it, there's a lot of accessory protein like heavy chain around it. And that causes potentially resistance over a long period of use. Xeomin, unlike Botox, is more pure. It doesn't have this big baggage around it. It's more pure. So there potentially be less resistance. In terms of all the study, it shows it works the same. You definitely can ask for Botox. We usually charge a little bit more. So, but Xeomin's been working great.
Okay, great. That was a very good explanation. All right, so how long does this treatment last, this jaw contour treatment with the filler? Okay, so how long does the treatment last? We use the VLIP method. So it depends on your condition. If you have a lot of volume loss contributing to the saggy jawline, then you'll need about between 2 to 8 vials a year. But if you're youthful and there's not too much volume loss, then you just need about 1 to 2 vials per year. Okay, all right, and will the gift card promotion, the gift card expire? There's no expiration for the gift card, so that's awesome. Yay, that's great. No expiration date. All right. So from Erica, what's the best way to book an appointment right now? Okay. You could go ahead and text that 909-839-0714. That's the first way. If you look at the chat, the second is just go and click and call at the, it's called Booksy. You could book it through that way too. So you could text, call that number. Okay, and let's see, how long does the filler last? It depends how many vials you put in. Let's say for a young person with very little volume loss, 1 vial radius will give her about 9 months to 12 months results. Others may, like the photo you see at the bottom, that lady that's aging gracefully, she needed about 5 fillers to last about 1 year. So it depends on your anatomy and facial structure. Okay, and I also got a question for alt therapy. Let's see. I think the question was about if they get the bundle treatments with the laser, how long is it going to last? Okay, so the question is that if you got the, I assume the question is bundle treatment or the VLIP protocol 1, 2, 3, it should bring it up to 1 year, maybe 1.5 years for the whole thing. Now, we do recommend that you return every
6 months to do something small to kind of retain the result you have. Not the whole thing, but just like a touch up every 6 months.
Okay. So Natalie asks, how many gift cards can we buy at once?
Hi, Natalie. So how many gift cards you could buy at once? You could purchase one for yourself. And I think Vicky mentioned you could purchase one for, you could send the link, I believe, to your friend. Vicky,
Yeah, so
do I have that correct? Can I refer this back to Vicky?
yeah, let me answer that question. So you can purchase multiple gift cards. You can send the link to your friends and family, but with one, you can only purchase one gift card under like one name. So let's say if you want to purchase for yourself and for your mom for Mother's Day. So you can purchase one under your name and you can purchase another one under your mother's name. But however, you cannot purchase two gift cards under, you know, the same name. Was that clear?
Yeah, that sounds good. All right.
So what are the things that I need to watch out for after the treatment?
So the question is, what should we watch out for after the treatment? The post-care would be avoid, so before you come, avoid any blood thinner, like aspirin, but check with your doctor, okay? And afterwards, check with the doctor, avoid blood thinners, vitamin E. Number 2, try not to have too much facial expression. Number 3, especially if you're doing the Xeomin, because they can move. So try not to press on it for the first 24 hours.
Okay.
Okay, guys?
Okay, so Cindy again, please explain laser. What does it do? It's Cindy, your best original customer.
Hi, Sandy. There's different kinds of lasers, and the one that kind of tines the skin, improve the jawline, would be called all therapy. All therapy tines the skin. We kind of give you some numbing before the treatments, and it works great. It takes about 1 session. You could come in for 1 session every 9 to 12 months, and you see 10% improvement, that instant improvement, that lift. But the best improvement is after 6 months, and we could just work on the jawline area.
Okay, so that was about 30 minutes of the talk. Thank you everyone for participating. Due to limited time, I apologize if we missed anyone's question. You can always text us or ask questions on Yelp. We respond within 1 or 2 hours. And if you text us, you didn't receive any response, please text again. Usually we're very quick and very good with the responses. All right, so we are sending, oh, actually, I got one more question that I can answer. This is important about the gift cards. So Sherry is asking, can I use my gift card in the clinic? The gift card is for online purchase only. All right, so okay, so for more questions, you can text us or ask on the Yelp. All right, so right now we just sent a survey, a link to you, to your email for event feedback. And we're also going to post the link on the this YouTube. I love to listen to your opinions about this online event. It will take less than 5 minutes. So please fill out the survey so we can make our future online events more suitable for your interests. And those of you who asked for PTO threads, please fill out the survey. All right, and now I am going to post the link that you all been waiting for, the $100 get $100 buy $100 get $100 free gift card. Please note that this link is only available for 48 hours. After 48 hours, this promotion will be gone. So you have 48 hours to purchase the gift card. So don't miss this opportunity. Go to the link right now, get the gift card, and also send it to all your friends and family. Sharing is caring, right? After purchase, you're gonna get a code in your email in about an hour. So make sure you check your email for the codes. Okay. All right.
Hi guys. Vicky, if I could just have one more comment. So we're gonna close this meeting, and I just want to say that I look forward to connecting with you. Hopefully you will have a great time again. And Sandy, Helen, and many of you guys, we know each other for a while. So thank you for your support. And to everyone, please stay safe. We love you. And most of all, thank all the Skin Perfect staff member who works together to make this possible. Thank you so much. We love you. Take care.